Hello friends, good morning. Welcome to a session on antibiotic review. Today we will be reviewing Tegicycline antibiotic, which is a glycyl cycline group of antibiotic. Now this Tegicycline group of antibiotic acts by inhibiting the protein translation by binding to the 30S ribosomal subunit and blocking entry of amino acid transfer RNA molecule to the A site of the ribosome. Now, this substitution pattern is not present in any naturally occurring or semi-synthetic tetracycline, and it imparts a microbiological property to this Tegicycline. Tegicycline, because of this antimicrobial property, has a bacteriostatic effect. However, bactericidal activity is also noted against Enterococcus faecalis and Enterococcus faecium Legionella pneumophila species. Tegicycline is not affected by the tetracycline resistant mechanism developed by the bacteria like ribosomal protection and efflux pumps. Now the question arises, how is this tegicycline different from minocycline? So the minocycline antibiotic, the minocycline molecule by substitution at the ninth position by NN dimethylglycine amido group makes the antibiotic structure tegicycline. This tegicycline has 5 times more affinity to 30S subunit as compared to that of minocycline. It also allows This substitution also allows an expanded spectrum of activity and decreased susceptibility to the resistance. Tegicycline has an expanded spectrum of activity against gram-positive organisms, gram-negative organisms, and even MRSAs. Now the question arises, how effective is the spectrum of activity? So it has a good spectrum of activity against atypical organisms, Enterococci group of organisms including vancomycin resistant Enterococcus, Staphylococci including methicillin resistant Staph aureus, Streptococcus pneumoniae group. Acceptable activity against gram-negative bacilli and anaerobes. But what is most important is it is poorly active. Remember 4 P's. The first P is poor activity against the 3 P's, Pseudomonas species, Proteus species, and the Providentia species. So if we are suspecting infections from Pseudomonas, Proteus, or Providentia, do not use this antibiotic. Already studied that it is a static group of antibiotic but has cidal activity against which organisms? It is Enterococcus faecalis, Enterococcus faecium, and Legionella pneumophila species. If we study the pharmacokinetics of this drug, the volume of distribution is 7 to 9 liters per kg, has a good tissue penetration, and a protein binding of 71 to 89%. Where does it penetrate well? It penetrates most into the gallbladder, followed by intestine, and then lungs. This antibiotic undergoes metabolism in liver. After metabolizing in liver, it is being excreted in urine. 33% of the metabolite is excreted from urine, whereas 59% is excreted from feces. It doesn't need any dose adjustment in renally impaired patients, but dose adjustment is needed for hepatic impairment. In moderate liver dysfunction, the elimination half-life is increased by 23%, and in severe liver dysfunction, the half-life is increased by almost 44%. So, in patients with liver impairment, we have to be cautious and modify the dose of this drug. As already studied, the drug concentration is most in the gallbladder, 2300%, and this gallbladder has 2300% concentration of the drug. Colon has 260% of the concentration of the drug. alveoli 780 to 132% of the drug concentration. Because of this high drug concentration in these tissues, it is effective against intra-abdominal infections, community acquired pneumonias, and skin and subcutaneous tissue infections because it has a higher concentration in epithelial lining fluids. If we retrospectively go and see the data analysis, the pooled analysis of 8 randomized controlled trial studied the Tegicycline versus the comparator drugs, there was no significant difference. The reason was that this antibiotic has got a to good tissue penetration. So, the effectiveness of this antibiotic in treating bacteremias or bloodstream infections is very poor. Again, if we study the cure rates of Tegicycline as compared to levofloxacin for community acquired pneumonias, the cure rates are almost 90.9% bacteremic cure rates for community acquired pneumonia versus levofloxacin 76.9%. So again, this antibiotic is showing an upper hand in treatment of community acquired pneumonias or ventilator associated pneumonias. The Again, the trial group for Tegicycline had studied its effectiveness in intra-abdominal infections, where they found that comparison with the imipenem cilastatin group, Tegicycline had almost a comparable bacteremic cure rates. Thirdly, the skin and subcutaneous tissue infection, the Tegicycline 200 study group, that came up with a comparable cure rates of 86.5 for Tegicycline as compared to 88.6 for vancomycin as Shunam group. This was by Postier, RG et al. To the Tegicycline 200 study group. So all these retrospective studies contributed to a conclusion that this antibiotic is non-inferior as compared to its competitors in standard treatment of complicated intra-abdominal infections, skin subcutaneous tissue infections, and even in community acquired pneumonias. Only thing which we have to remember, the conventional dose is 100 milligram loading followed by 50 milligrams 12 hourly. We need not modify in renal impaired patients. We need to modify the dose of the drug in liver disorder patients, liver impairment, moderate liver impairment, or severe liver impairment. Never forget the 4 P's. Has got a poor activity against Pseudomonas, Proteus, and Providentia. So this was a short review about the use of Tegicycline and what it is pharmacokinetics and pharmacodynamics. Thank you. In the next lecture, we will be reviewing another tetracycline, that is minocycline group of antibiotics. Till then, take care. Goodbye.